Good morning, friends. I am Dr. Hemant. I am working with Indus Group of Hospitals as EGM billing. मेरे साथ हैं Dr. Ravneet Kaur. She is my colleague, and today we will discuss about health insurance and cashless hospitalization. What are the benefits of health insurance and how it helps in cashless hospitalization? So, Dr. Ravneet के कुछ questions थे मेरे लिए, तो let us discuss it.
मेरा पहला क्वेश्चन है सर, व्हाट इज हेल्थ इंश्योरेंस एंड व्हाई इज इट इम्पोर्टेंट?
Yes. So health insurance जो है, it is a contract between the buyer, the policy holder and the insurance company. Under this contract, insurance company cover करती है medical expenses को for the beneficiary under few terms and conditions.
नेक्स्ट क्वेश्चन है मेरा, व्हिच इंश्योरेंस कंपनी इज बेस्ट टू बाय एन इंश्योरेंस पॉलिसी?
See, Dr. Avneet, most of the insurance companies are under IRDA and all insurance companies are trustworthy. So more or less they are on the same platform. But yes, while buying a policy, you should consider the claim settlement ratio of the insurance company, customer reviews, network hospital list should be seen so that cashless hospitalization can be taken accordingly. And we should also consider the financial condition of the company. So there are few factors, but important is कि आप when you are buying a policy, you should convey each and everything about your past medical history to the insurance company, ताकि कल को अगर आप claim ले रहे हो तो उसमें कोई दिक्कत ना आए. Otherwise, it leads to non-disclosure or misrepresentation of facts.
हाउ मच सम इंश्योर्ड इज एडिक्वेट?
Yes, तो sum assured आपने देखा है in this era हर साल न्यू डिजीजेज आ रही हैं. अब कोविड में बहुत सारे पेशेंट्स अफेक्टेड हुए, लोगों को बेड्स नहीं मिले और बहुत ज़्यादा एक्सपेंडिचर्स बढ़ गए थे उस टाइम पे. अलॉन्ग विद दैट रिसेंटली इबोला वायरस जो है वो इवॉल्व हुआ युगांडा में. बर्ड फ्लूज आ रहे हैं, तो डिफरेंट डिजीजेज, डिफरेंट वायरसेस आर कमिंग दीज डेज और ये डेडली डिजीजेज हैं जिसकी वजह से बहुत एक्सपेंसिव हो चुका है मेडिकल ट्रीटमेंट. So on that basis, I would suggest that we should go for at least 10 to 20 lakhs of policy to cover the expenditures. Yes, along with that, you can buy super top-up policies which are comparatively cheaper, or when your base policy exhausts, these super top-up policies gets active. So this way you should go ahead.
व्हाट इज कैशलेस हॉस्पिटलाइजेशन?
या कैशलेस हॉस्पिटलाइजेशन. कैशलेस हॉस्पिटलाइजेशन में क्या होता है, जो पेशेंट है, जो पॉलिसी होल्डर है, वो डायरेक्टली नेटवर्क हॉस्पिटल में जाता है और उसका कैश फ्री ट्रीटमेंट होता है. यानी कि इंश्योरेंस कंपनी डायरेक्टली पे करती है हॉस्पिटल को. दे विल बी डायरेक्टली पेइंग द हॉस्पिटल, पेशेंट विल गो इन द हॉस्पिटल, विल टेक ट्रीटमेंट एंड विल कम बैक. सो एलिजिबिलिटी इज ओनली अ वैलिड हेल्थ इंश्योरेंस पॉलिसी.
हाउ टू अप्लाई फॉर कैशलेस हॉस्पिटलाइजेशन?
See, once you see a doctor, the doctor will prescribe you admission either for a conservative or surgical treatment. So taking that prescription letter, you should go to the TPA desk of the hospital. They will raise a request to the insurance company for cashless approval. Documents required for it are valid health insurance policy or a health insurance card. Secondly, a valid identity proof like passport, Aadhaar card or PAN card. Third is your prescription letter, as I told you. And fourth is, if you have any past history, there should be all the documents, because it is mandatory to raise the documents to the insurance company.
हाउ लॉन्ग डज कैशलेस अप्रूवल टेक?
On an average, it takes 2 to 4 hours to get a cashless approval, but it also depends upon the policy. See, if you have a old policy, then there would not be any waiting period. कोई waiting period नहीं होएगा उसमें एक्सक्लूजन नहीं होंगे. सो दैट वे जल्दी आपकी अप्रूवल आ जाती है. अगर आपकी पॉलिसी 5 years या उससे ज़्यादा चल चुकी है, देन मोराटोरियम क्लॉज इज एप्लीकेबल इन दैट, एंड अंडर दिस मोराटोरियम क्लॉज ऑल द PEDs आर कवर्ड. सो इन दैट केस ऑल्सो अप्रूवल्स बहुत जल्दी आती हैं. बट इफ देयर इज एनी डाउट ऑफ इंश्योरेंस कंपनी कि कोई PED है विच वॉज नॉट डिस्क्लोज्ड, तो उस केस में इंश्योरेंस कंपनीज मल्टीपल क्वेरीज जनरेट करते हैं जिसकी वजह से अप्रूवल लेट होती है और समटाइम्स इसमें कैशलेस डिनाई भी हो जाता है.
ओके
जी.
इज कैशलेस फैसिलिटी अवेलेबल फॉर ऑल ट्रीटमेंट्स?
No, cashless is available only for those treatments which are covered under the policy. There are few permanent as well as temporary exclusions. Permanent exclusions में आता है intentional self injury, which is
Okay.
not covered under the policy. Secondly, you can say plastic surgery for cosmetic or aesthetic purposes. In accidental cases plastic surgery is covered, but if you are going for a cosmetic purpose, so in that case it is not covered. Other examples are external congenital diseases like cleft palate, cleft lip, phimosis, or treatment like gender change. Regular dental treatment is also permanently excluded. So there are list of diseases who are like this. Temporary exclusion, on the other hand, are you can refer to waiting period. So in every policy there are waiting period. Like when you buy a policy, only roadside accident is covered for the first month. After 1 month, there would be acute disease which are covered under the policy, and there are a few planned surgeries like hernia, laparoscopic cholecystectomy, joint replacements including TKR, THR. So such diseases are not covered for the initial 1 or 2 years. And lastly, PED, pre-existing disease. If you have disclosed some PED, probably it would not be covered for 3 to 4 years. It depends upon the policy.
Can cashless approval be partial?
Yes, cashless can be partially approved. If the policy is having some limitation, then definitely there would be complete cashless is not approved. For example, if there is co-payment, अगर co-payment clause है तो 20% suppose co-payment है policy में, तो अगर hospital का bill 2 लाख रुपए है, 20% means 40,000 rupees. That will be borne by the patient. Patient will be paying 40,000 rupees. Rest will be paid by the insurance company. Secondly, sublimits. There are few diseases, few policies wherein treatment-wise, disease-wise, sublimit is applicable. For example, if you have a policy of 10 lakhs and there is a sublimit for cataract, suppose for 50,000 rupees, तो चाहे आपकी पॉलिसी 10 लाख की है, but you will get only 50,000 rupees for cataract case because there is sublimit to that. Third is consumables coverage. Nowadays policies are there जहाँ पे हमें riders मिलते हैं, consumables are also covered, but sometimes policy does not cover consumables like gloves, caps, diapers, sanitary pads. So such kind of things are not covered under the partially cashless approval का एक और रीजन हो सकता है, वो है सम एश्योर्ड एग्जॉस्ट. अगर आपकी पॉलिसी 2 लाख की है और आपका हॉस्पिटल बिल 3 लाख का बन गया, तो इन दैट केस ऑल्सो 2 lakhs मैक्सिमम सम एश्योर्ड वुड बी पेड बाय द कंपनी, और जो ऊपर का खर्चा है, जो भी रेस्ट ऑफ द डिफरेंस अमाउंट है, विल बी पेड बाय द पेशेंट. सो दैट वे समटाइम्स पार्शली claims are approved partially.
Types of admissions are covered under cashless.
Type of admission, yes, there can be two type of admission. First is emergency. Emergency case में patient comes in the hospital and treatment gets started. So in that case, hospital raise a request on behalf of patient for cashless approval. तो इसमें particularly roadside accidents आ जाते हैं जो कि day 1 से cover है, या acute diseases हो सकती हैं, कोई कार्डियक इमरजेंसी हो सकती है. सेकेंड आर प्लान्ड एडमिशंस. सो प्लान्ड एडमिशंस में क्या होता है, सपोज इफ समवन इज रिक्वायरिंग अ प्रोसीजर और सर्जरी फॉर कैटरैक्ट और हेमोरॉइड्स और हर्निया, सो इन दैट केस वी टेक अ प्रायर अप्रूवल बिफोर द डेट ऑफ एडमिशन. वी कैन टेक इट विद इन 7 days ऑफ द प्रायर टू द डेट ऑफ एडमिशन. अगर एक पेशेंट को सपोज 7 तारीख को कोई सर्जरी करनी है, तो उसका 5 को या 4 को पहले ही हम डॉक्यूमेंट्स डाल के इनिशियल अप्रूवल मंगवा लेंगे, ताकि जब पेशेंट हॉस्पिटल में आए तो वो अंडर कैशलेस कैटेगरी उसका ट्रीटमेंट हैसल फ्री रहे. जी.
Does pre-authorization guarantee cashless treatment?
No. See, pre-authorization is raised by us at the time of admission. When the patient gets admitted, we raise a pre-authorization to the insurance company. But once we get the initial approval, it means the policy is valid. Secondly, the treatment is covered under the policy. But once the patient is getting discharged, so at that point we get a final approval. Final approval पे ही ये श्योर करा जा सकता है कि उसका कैशलेस ट्रीटमेंट हुआ है. Because during the hospitalization, invigilator may come to the hospital. वो इन्विजिलेटर सारा केस देखता है, आईसीपी देखता है, डिस्चार्ज समरी पे कंपनी डिस्चार्ज समरी देखती है, सारे फैक्ट्स को वेरीफाई करती है. इफ दे फाइंड एनी पीईडी व्हिच इज नॉट डिस्क्लोज्ड, देन द केस मे बी डिनाइड. सो कैशलेस प्री ऑथराइजेशन अप्रूवल मींस वैलिडिटी ऑफ द पॉलिसी.
Reasons for cashless denial.
See, the first and foremost reason for cashless denial is non-disclosure of PED, pre-existing disease. अगर मैंने पॉलिसी ली, मेरे को हाइपरटेंशन है या डायबिटीज है, एंड इफ आई एम नॉट डिस्क्लोजिंग इट टू द इंश्योरेंस कंपनी गिव्स मी द पॉलिसी, नाउ लेटर ऑन दे फाइंड इट कि मेरे को पहले से ही कुछ डिजीजेस थी, तो इन दैट केस इट इज ब्रीच ऑफ ट्रस्ट अंडर द कॉन्ट्रैक्ट। सो ड्यू टू दैट रीजन इंश्योरेंस कंपनी जो है आपका क्लेम डिनाई कर सकती है। सेकेंडली इसमें जो एक्सक्लूजन का हमने बात करी थी, टेम्पररी और परमानेंट एक्सक्लूजन। सो टेम्पररी एंड परमानेंट एक्सक्लूजन्स आर नॉट कवर्ड फॉर सर्टेन पीरियड ऑफ टाइम, दैट इज वेटिंग पीरियड, सो दोज आर आल्सो नॉट कवर्ड।
Okay.
जी।
Consequences of hiding medical history.
See, we at Indus Hospital firmly believe that there should not be any concealment of past medical record. If the patient conceals it, then in that case, firstly, the patient's claim can be rejected. Second, the policy can also be cancelled. Third, the insurance company can take a legal action against the patient, and he can be blacklisted to buy any policy in future. Along with this, if the hospital also supports the patient, then it affects the insurance company and hospital relationship. On that basis, cashless tie-up can be withdrawn by the insurance company. जी.
What if a genuine claim is denied?
Yes, it is also possible that mistakenly by the insurance company, some genuine claims can be denied. So in that case, first step is a reconsideration. A hospital can put a reconsideration for cashless again. If it does not gets allowed by the insurance company, तो second step पे patient को bill pay करके खुद reimbursement लेनी होती है. So 90% of the cases, patient is able to get the reimbursement, but sometimes even it is not considered under reimbursement. तो third step पे patient को raise करना चाहिए एक complaint in the grievance department of the insurance company. If the grievance department allows the claim, it is well and good. And if it does not, so in that case, after 30 days, patient can go to ombudsman or consumer forum. So ombudsman is a government-backed authority which facilitate a policyholder to raise any complaint against the insurance company. So there he can get the remedy. I hope this session was very useful for all of you. In the last, I would request that while buying a policy, you should always tell insurance company all about your medical history so that you get a claim in future. Secondly, you should keep a soft copy of your insurance card or insurance policy with your identity card so that in case of need, in case of emergency, you can produce it to the hospital. I hope you enjoy this session. Thank you so much.